So even though I'm a pediatric dentist, I do see adults for airway evaluations. That came out of parents bringing their children in and then getting curious about themselves. And there are not many other dentists that are educated on adult airway health. So that is the one area that I will see adults for. Now, I do not do expansion or jaw surgery, but what I do is screen for tongue ties and assess the health of their airway and give them a roadmap of what they need to do next and what the options are. And I have some wonderful partners here in Houston that do jaw reconstruction and adult expansion. And eventually, if they need a tongue tie release, then I will perform that. But during that adult airway screening, we take a CBCT of the airway. What I find is many adults have no idea how compromised their airway is. A lot of them get to me because they realize they have a tongue tie or they've been doing some myofunctional therapy and they want to get their tongue tie released. But we, again, have to look at the bigger picture. So some adults are not even candidates for a tongue tie release if their airway is too small. Also, we know that their tongue tie release is probably not the root cause of all the sleep problems that they're having. So again, we want to make sure that we're looking at the bigger picture, the jaw structure, the airway health, and the tongue tie and musculature, and then guide them as to where they need to go next. But if they need a tongue tie release at that time or in the future, that is when I step in and do the actual procedure.